Welcome to the Happy Doc, the voice of fulfilled physicians. This show is about bringing inspirational, creative, successful, and happy health professionals to you. Get ready to learn how you can be a happy doctor too. Hello, everyone, and welcome to another episode of The Happy Doc. This is Dr. Taylor Brana, your host, and for this episode, we have a huge guest, and that's Dr. Mimi Guarneri, a global health leader, quite literally. She has a tremendous amount of academic and career achievement. She is currently board certified in cardiovascular disease, internal medicine, nuclear cardiology, and integrative holistic medicine. She is the past president of the American Board of Integrative Medicine and the current president of the Academy of Integrative Health and Medicine. She also serves as a founding board member of the American Board Physician Specialties in Integrative Medicine, and she's a clinical associate professor at the University of California in San Diego. She's also co-founder and medical director of Guarneri Integrative Health Incorporated at Pacific Pearl La Jolla in La Jolla, California. She, again, is literally a global leader in health. She recently visited the Vatican and talked about the impacts of climate change on human health. In this conversation, we're going to learn about integrative medicine, how it started, how we can prevent chronic illness, and the impacts of pollution on human health. We move on to a discussion about biography and how that can impact health. We discuss how Dr. Guarneri substantially improved her cholesterol levels. We then go into a conversation about sustainable community health and how that can literally impact the world, and the importance of purpose in a case example from an 82-year-old World War II fighter pilot. Before we begin this episode, I want to give a huge shout out to AIHM, that's the Academy of Integrative Health and Medicine, for supporting the Happy Doc and this episode. The AIHM organization is tremendous, and they have a huge mission, vision, and purpose I want to tell you about. Their mission is to transform healthcare through interprofessional unification. Their vision is to see a world where humanity and the planet are healthy. The purpose of the Academy of Integrative Health and Medicine is to create a society and global community of professionals and health seekers. They provide education, training, leadership, interprofessional collaboration, research, and advocacy that embraces all global healing traditions to promote the creation of health and the delivery of evidence-informed, comprehensive, affordable, sustainable, person-centered care. And that's an incredible mission, vision, and purpose from the Academy of Integrative Health and Medicine. And if you go onto AIHM.org, you will see on their website that they provide conferences, they provide a fellowship for integrative medicine, and it's a great page to get to know what integrative medicine is and how you can be a part of this community. To learn more, check out AIHM.org. And now we're going to listen to the president of AIHM, Dr. Mimi Guarneri.
Hi, thank you for having me, Taylor. I've had quite a journey. I started my career in the 90s as an interventional cardiologist, and after placing over 700 stents a year in arteries, began to realize that we needed to do something different to prevent cardiovascular disease. So for me, it's been a 25-year journey of learning everything I can about treating the whole person, body, mind, emotions, and spirit, and really looking at how our conventional medicine training is great in acute care. If you have a heart attack, we're really good in that setting, but how we fall short in the way we treat chronic disease, and the fact that we tend to focus on the physical bodies and forget that people are made up of emotions and spirit. So I'm a cardiologist, an internist. I'm board certified in integrative medicine. Yes, integrative medicine is a specialty. And I have a wonderful practice in La Jolla, California at Pacific Pearl La Jolla.
Amazing. Well, this is going to be a great conversation. So I actually just recently watched one of your YouTube videos. It's called Why Integrative Medicine is the Only Solution to Chronic Illness. But let's take a little step back here. For the listeners who do not know, what is integrative medicine?
So the way I like for everyone to think about it is it's a holistic approach that engages treating the whole person, again, body, mind, emotions, and spirit. If you practice integrative medicine, you focus on getting to the underlying cause of a problem, and you have many, many tools in your toolbox because you recognize the importance of all of the global healing traditions. And one simple way I like to explain it to my patients is if you have a tree and your tree has some sick fruit on it, we can say, okay, the tree is sick. The sick fruit could be labeled diabetes and high blood pressure. You know, in Western medicine, we say, oh, you have diabetes, take this pill. You have high blood pressure, take that pill. Oh, you're depressed, take this other pill. Where in integrative holistic medicine, we say, let's look at the soil. Why do you have diabetes? What are you eating? Are you active? Are you sleeping? Where are you at emotionally, mentally, spiritually? Because all of these things, how we live our life, interacts with our genes, then determines whether we're going to be sick or be healthy. So to me, it's all about getting to the underlying cause of a health challenge, treating the whole person, and recognizing that in Western medicine, I may not have the tool in my toolbox, so I may reach into another toolbox, such as learning meditation or using acupuncture or herbal medicine. You know, we have so much wisdom.
Wow. And I have a couple of questions here. You know, being recently a freshly minted resident, I just got out of medical training not too long ago. So you touch on the soil. You know, the soil is the important part of this whole process. And meanwhile, we're all focusing on the fruits, right? So why is it that we're not learning, you know, more of this lifestyle type of education, the nutrition? Do you have any sense of that?
Well, I think a piece of it is there's so much to learn in medical school and there's so much at risk. So, for example, in the acute care setting, we are really, really the best. Nobody can beat us there. If someone comes in with chest pain, for example, we're saying, okay, is it a heart attack? Is it an aortic dissection? Is it a pulmonary embolus? And then we are trained to go through what we call our differential diagnosis. You know, we get some more information and then we can right away act on it. Go to the cath lab, go to the OR, get the right medications, and so on. So I think when you have a limited curriculum, there's a picking and choosing of what's going to go into that curriculum, and many, many things got cut out. And so the things that got cut out basically are mind-body medicine, nutritional medicine, and all of the global healing traditions from osteopathic medicine, which we don't learn about in an MD school, right? You know, right? I mean, most MDs coming out of medical school don't even know what osteopaths do, homeopathic medicine, traditional Chinese medicine, Ayurvedic medicine, and so on. So we have a limited education, good for acute care, but we can't apply it to everything.
Amazing. And so, you know, I'm more familiar of some of the different treatment modalities we have, you know, coming from an osteopathic school. There are going to be individuals that are hearing this and will say, you know, there's no research in Ayurvedic medicine, or there's no research in acupuncture, and I know they haven't traveled deep enough. What do you say to people that feel that way?
Well, I think, first of all, we have to look at what is the evidence, right? So let's just take a step back and say that every other global healing tradition other than Western allopathic medicine focuses on keeping people well, whereas Western medicine focuses on taking care of people after they break down. So one of the big movements in integrative medicine is for us to educate our colleagues, educate each other, and educate those who who just simply don't know about the evidence that there is out there, and there's significant amount of evidence. For example, acupuncture and headaches has phenomenal level A evidence for reducing pain and sick days at work and so on. Butterbur for migraines outdoes Indoral, for example. So, that's why integrative medicine is now a specialty. And we know from lifestyle that if you look at the InterHeart study, for example, 92% of first heart attacks could be prevented through lifestyle change. So we have this information through the language of science, but what we have not done is translated it into practice. So if we know a low glycemic index is good for a diabetic, why is a diabetic in the hospital getting mashed potatoes and pasta and liquid drinks that shall go nameless in little bottles that are pure sugar, right?
Yeah, and I've definitely, as you're saying that, I've definitely seen it. So I know that definitely happens. And I wanted to mention also, just experientially, my mom was complaining of lower back pain, and I remember her going to see a doctor, and they handed her, some NSAIDs and said, get better. But I followed that up with doing some osteopathic manipulative treatment. I did a few counter strain techniques, and she literally stood up and said, wow, Taylor, I've never felt this good like in the past year. So, even in those experiences, there's definitely something to be said about these techniques or these therapies that people aren't exposed to. So I'm definitely excited to have you on to talk with us more about that today. So to take a step back again, I did mention that YouTube video where you said integrative medicine is one of the only ways we can treat chronic illness. What do you mean by that?
Well, I think if you look at chronic illness, whether it's hypertension, diabetes, obesity contributing to much of what we see, you have to say arthritis, you have to say what is the underlying cause here. So if you take cardiovascular disease, dementia, they're all inflammatory diseases, oxidative stress. I mean, these are the sort of the end part of the game. So So when you say take a chronic disease like diabetes, and we say, okay, you have type 2 diabetes, we're going to give you this drug. Well, yeah, it's fine to give a pill, but what about getting someone eating a low glycemic diet? What about getting someone exercising and building up their muscle and dealing with the stress? Because cortisol, for example, raises blood sugar. So and then also looking at our environment, which was why I was at the Vatican, we were discussing the impact of the climate crisis on human health. And the reality is the more toxins we put into our environment, for example, pesticides, persistent organic pollutants, are now linked to insulin sensitivity, obesity, and type 2 diabetes. So integrative medicine understands this, and we are currently facing a crisis right now, not only in our country, but in the world. And it's a crisis that we don't have the money to treat, which is non-alcoholic fatty liver disease is on the rise. Diabetes is costing billions of dollars annually, and these are all preventable diseases.
Wow, that's really powerful. And I think it's really interesting you mentioned pollution as something that is very detrimental to our health. I think for me, I'll think about diet, definitely. I'll think about things like sleep. I'll think about things like stress. But pollution, that's something that I don't think we often focus on at all. What are some of the solutions we have on that front, or things you've been working on?
Well, one of the big messages the World Health Organization brought to the Vatican in November is that air pollution is now recognized as the number one cause of stroke and is an independent risk factor for cardiovascular disease. And an incredible study just came out within the last 2 months out of China showing that students in dormitories who have filtered air versus students who are breathing the standard air have a turning on of their stress hormones and a whole impact on their HPA axis as it relates to the adrenal system. So this is huge, huge. And how many times do I hear, oh, my cholesterol was perfect, my blood pressure is perfect, and I had a heart attack, and nobody is factoring in where did these people live, what kind of air are they breathing, and so on. And now the World Health Organization recognizes air pollution as a non-communicable as a cause of non-communicable disease, and that's a big one. And the solution is obvious: stop driving, start walking. Right? Stop burning things into the atmosphere. The biggest carbon footprint is coming from the pharmaceutical industry, right? They're one of the biggest contributors. The agricultural industry, another big contributor. We as human beings, right? Driving cars everywhere, leaving cars running idly. We have to be more conscious of what we're doing.
Wow. That was a really tremendous statement, and a difficult part for many people to grasp. I think people are just trying to just get by, let alone tackle, something that can affect us globally, but also terrifying in many ways, because this is something that affects every single one of us. We can't, this is all our ecosystems. So, wow, that's really powerful. So there was something you mentioned in that video that I thought was fascinating, and you are definitely touching on it. One thing you mentioned just now was geography, right? The importance of geography, and then also the individual's biography. Can you explain that a little bit more?
Yeah, absolutely. Well, we say our biography determines our biology, and basically, we're born with a set of genes. We call that our book of life, 23 chromosomes. But we now know, again, through the language of science, that the genes that we turn off and turn on genes throughout our life. And it's our epigenetics that ultimately are going to affect whether we get sick or we stay well. And it is fascinating to see the research coming out on methylation, for example, and the freeing up of genes to be read, the DNA to be read, and we start producing proteins that are pro-inflammatory, proteins that are pro-thrombotic, and so on. We turn on cancer genes. And what's even more interesting is research like Dean Ornish's research on prostate cancer, where he took men with Gleason 6 prostate cancer, and he said, let's teach you a vegan diet, yoga and meditation, put you in a support group, get you exercising. And he showed that you can down-regulate 500 cancer genes through lifestyle. Wow. So, so we know that, like, for example, meditation can improve telomerase activity, which is the enzyme of longevity. So we know beyond a shadow of a doubt that how we live our life, our biography, our story, the foods we eat, the air we breathe, do we sleep, how do we respond to stress and tension, our relationships, all of these things that go into our soil impact our health.
Mm-hmm. Wow. That's amazing. And I want to mention meditation because I'm a practitioner of meditation, and I have to say, on a pragmatic approach, something that it's done for me personally is every time I meditate, it gives me a pause, and I end up actually being inspired or having the energy to do things that are good for me. So not only has it been a de-stressor, a pause in my life, but I think it's actually been what I like to call a force multiplier, meaning it's something you do that helps other aspects or areas of your life. So it definitely has had a very practical and meaningful change in my life. We could talk about meditation for a long time, for sure. I wanted to discuss a little bit about integrative medicine as a whole. How did you discover that in your own life? Was there a specific moment? Did someone teach you about it? Was it just something you did? How did you kind of stumble upon that?
Well, there was really no word for integrative medicine when we when we were part of coining it, a number of people in the 90s. What happened with me was I was very much working more as a surgeon, an interventional cardiologist, when I was invited to do some research on very sick heart patients with Dean Ornish. And he said, I'm going to give you some of the take your sickest patients that you can't put a stent in and put them into this program where you teach them how to eat a vegetarian diet, yoga and meditation, exercise, group support. And I thought at first this was totally crazy. Mm-hmm. And so I began to participate in the research, and I was a primary investigator at the time in Southern California. And I began to see this transformation in my patients that was, I cannot tell you, it was unbelievable. Mm. People's chest pain started going away. People started decreasing their weight. They had more energy. Their relationships got better. They were talking about what was going on with them. And it was like this light bulb went off, and I realized, oh my God, we're so strong on the intervention side, the surgery side. Why aren't we as strong on the prevention side? Mm-hmm. And that really got me to look at cardiovascular disease prevention. And then I found the American Holistic Medical Association, the American Board of Integrative Holistic Medicine, which are now both the Academy of Integrative Health and Medicine. And I started going to conferences and hearing MDs, colleagues, talk about mind-body medicine, talk about food as medicine and how you can transform lives through nutrition and meditation and yoga and so on. And it just began opening up a whole world which was left out of medical school.
Amazing. So I don't know which question I want to choose. So what's coming up now is you discuss these transformations that you saw. At first, you were almost in disbelief, right? So can you give us an example of a transformation that you saw that totally blew you away?
For myself or from a patient?
I mean, can you maybe discuss yourself? That'd be really powerful.
Well, I could tell you from myself, when I started to become interested in this arena, it made me look at my own life as a clinician. Mm-hmm. And I began to realize that I was running 24/7, type AAA personality, eating whatever food I can find behind the nursing station, which usually meant it was donuts and coffee, mm-hmm. and really not looking at my own life and what was going on for me. And so I decided I was going to do some blood work along with my patients, and I found I had a cholesterol of 320, which was kind of off the charts for I'm not a very big person, and I never was, and mm-hmm. You can be thin and still have high cholesterol, but I was shocked at the number, and I realized I needed to change along with my patients. So I went on the journey where I started to learn yoga, and I learned to meditate, and I became a vegetarian. And I never looked back. I absolutely never looked back. And I always credit Dr. Ornish with really opening my eyes through the research that we did to my own health. And then from there, of course, once you start, you begin to ask deeper and deeper questions, and it continues to this day. I began to do training in healing touch. I became a healing touch practitioner. I started to get very interested in all of the global healing traditions because I thought, my God, what else did I not learn in medical school? And I always went into everything as a skeptic, mm-hmm. but I never closed the door on something until I evaluated it. So for me, I went from a cholesterol of 320, and I kid you not, to a total cholesterol of 100 by becoming a vegetarian. And in terms of my mental state, meditation has been, I was trained in transcendental meditation, mm-hmm. and TM totally changed my life. And for me, it was just the right meditation, Yeah.
No, I'm a big fan of TM. I also took a TM course as well. It's definitely an amazing process. Wow, that is phenomenal. And so what I love that you just said is you were, first off, you're skeptical, so you had to test it. Two, you're practicing what you're preaching, which I really love because, unfortunately, and a lot of the times, whatever treatments we give to people, it's not something we're doing. You mentioned actually in your YouTube video, you had the smoking cardiologist, right?
Right.
You're encountering people who aren't healthy yet are educators on health. So I think it's an interesting field we play in. The other question I had was, how do you take on a patient that has never looked at all of these areas of life, hasn't poked around and increased their awareness of these things? How do you educate them or start them on their path?
Well, I find using the tree analogy the simple one because I say, if you have a sick fruit on your tree and it's labeled diabetes, and then I ask patients a simple question, if we go into the soil, do you think the food you eat is impacting your diabetes? And everyone says, yes, of course. And then they may not be aware of micronutrients. For example, depletions of chromium and magnesium will also make diabetes worse. And do you think your sleep affects your diabetes? And patients will say, absolutely. And I haven't slept well in 10 years, and then I educate them about toxins in the environment. And then what about stress? Do you think stress affects your diabetes? Yes, absolutely. What about exercise? Yes, of course. The next logical question is, if we were to work on your nutrition and your exercise and how you respond to stress, what do you think might happen to your diabetes? Oh, it's going to get better. So, to me, that's a very practical, same thing with hypertension. If your blood pressure's high and you're eating, hot dogs filled with salt and ham all day, that's the cause for it. Or you're stressed out of your mind. Well, how are we going to impact your blood pressure? So people get it. People do get it. And quite frankly, I think a lot of Americans are sick and tired of taking so many pills because we have this ill to the pill thinking. Everything we can label, we have a pill for: diabetes, high blood pressure, cholesterol, fatty liver, depression, heartburn. Everybody's got heartburn, and everything. Nobody could sleep. We have a pill for that too, right?
Yeah, definitely. So I want us to move this conversation towards physicians and the medical practitioners and health practitioners. I'm sure there's been many individuals in these fields who have met you, who have discussed things with you. What is a first step that we can do to start to change our own culture, start to change the way we think so that we can be happier, we can be more fulfilled?
Well, I think the first thing we have to do is recognize that the healthcare system is a sick system that's broken down. And it really, as you said, you never expected to get sick going through medical school.
Yeah.
And unfortunately, what we're seeing today is a very high divorce rate amongst physicians, alcohol use rate, a high suicide rate, and so on. And most physicians are saying 67% that they're burnt out. And so, when we went to medical school and made the decision to serve, medicine is a service, right? And we made that decision because we had a sick family member or we wanted to help people and whatever. It's usually for a very, very good reason. Very few of us said, I went to medical school to make money. That's usually not the case. And unfortunately, what we're seeing now is a lot of our colleagues are hurting. And because we're the doctor, we're not allowed to tell anyone. We have to suffer in silence.
Right.
And that's exactly what people do. Suffer in silence. I don't want to seem weak. How many colleagues pull me over in the hall and say, I had this little chest pain. I said, no, you're not allowed to do this in the hallway. We have to check you out properly.
Yeah.
But they're embarrassed. What if it's wrong? What if it's, I didn't want to go to the emergency room, because we seem to think that we're not human. And we have all and then you couple that with a system that rewards you for staying late, doing more, and not taking care of yourself, right? And that's not healthy.
Yeah, definitely. I mean, and that conversation that you just had, that what you just stated is what we touch on a lot on this podcast. So I definitely thank you for mentioning that. And definitely, I think we're gonna have to admit that we have a problem first. And talking about something like meditation, talking about these things where you even discuss it yourself. You took ownership and started making changes in your life. I agree. We're going to have to start to look at ourselves and see what we can do on our personal levels to make change. Definitely. So I took a look at your website, and on it, you made a statement where it said you want to establish a new paradigm of healthcare for humanity and the world as a whole. You're looking at a very big picture. What drives you to make that big change?
Well, I've seen it, right? I've seen the power of working together with my colleagues. I can't do everything, but I've seen the power of working in teams, like here at Pacific Pearl. In La Jolla, we have an incredible team. We have an osteopathic physician who right now is seeing one of my patients who is having a hip issue. What could I do with it as a cardiologist? But I know he's going to help her enormously. And we have traditional Chinese medicine and naturopathic doctors. And so, I think the key is, one, working together interprofessionally. Mm-hmm. I think the one-on-one part of medicine, short of acute care, is not going to work. We need healthy communities. This whole thing about hospitals having accountable care organizations. So what if you're not a member of that hospital, right? Mm. So I think we need to look at our communities and how do we get our communities healthy. And then, of course, the impact is going to be on our planet, because if we do things that keep us healthy, if we are eating less meat, if we're walking more, if we're not using plastic, if we're not buying foods that are packaged in styrofoam and so on, yeah. I mean, we're going to be helping ourselves and helping our planet. So I think everyone has it within them to say, what can I do today that's going to make a difference? And if you start adding up, as Dalai Lama says, we have 7.5 billion light beams on this planet. And if all of those light beams say, I'm going to do my share today, we can have a huge impact.
Wow. I love that. Definitely. And it starts with conversations like these and listening and actually trying to make a change. Definitely. Wow. One thing that you mentioned that I thought was very powerful in your practice is you said you had an osteopathic doctor. There's a naturopath as well. So what is something like a community like that? What does that do in terms of the treatment for the patient? I'm first seeing in my mind, there's a spectrum of different ways you can treat them, right? How has that helped the patient? Also, what knowledge has that provided for you?
Right. So, we believe in a therapeutic order. So, this as a doctor of osteopathy. If somebody comes in, they have back pain, I'm sure the first thing you don't think about is the MRI, right? Right. Where if you go into a Western trained physician, you say I have back pain, well, we'll get an MRI, we'll see what's happening. So when you have a well-rounded team, you can really go with the therapeutic order and you can say, let's have the expert in musculoskeletal medicine, i.e. the osteopathic physician or your chiropractor, take a look at you and evaluate you and see if we can get you, your pelvis aligned or whatever the issue is and get you feeling better. So I think it enables us to when you have a hammer, everything's a nail, Taylor, right? Yeah. So when you're an MD in the Western medicine training, this is what your hammer looks like. I have a drug, I have a surgery, and maybe I have some physical therapy. Mm-hmm. Short of that, I don't have a lot in my toolbox, and so that's what everybody gets.
Mm-hmm. Yeah, wow. Yeah, that's very true. And I think the important theme that I'm touching on and I'm learning from you here is you had to increase your awareness to even know that there are these options out there. And it's a disservice definitely to us that we aren't often trained on these other areas or even been exposed to them. And if you don't know, or if you haven't been exposed to it, how can you know that that's even an option? So that's a really powerful thing that we're discussing here.
And also, if your insurance doesn't cover it, so if you have back pain, and they say, well, your insurance will cover you going to see an orthopedic surgeon as the first step, as opposed to seeing the osteopath, the massage therapist, the acupuncturist, the healing touch practitioner. There's a whole series of things that can happen with the right examination and the right triage, short of sending you to an orthopedic surgeon. And patients will frequently say, well, does my insurance cover that? Well, no, my insurance doesn't cover it. I guess I'll have the surgery. And that is really bad medicine.
Right. And you brought up a great point. So, these things aren't incentivized, right? So we're not aware of a lot of these treatments. We're not, provided incentive. So we're definitely marginalizing the people that can even get these treatments.
Well, and I don't think physicians should be incentivized. For example, I think I really, this business about paying physicians to, that you can have a couple of different kinds of cardiologists, right? You can have a preventive cardiologist, and then you can have a cardiologist that does interventions. And one will make a third of what the other one makes, and you can argue and say, well, they have to do these procedures and it's more stressful. But the reality is, the insurance company pay more money for those procedures than to teach someone how to eat. So it's what we value as a society, and we need to have a community-based systems that keep people healthy, what we like to call our health commons, right?
Wow.
And that may be within our community, our farmers markets, our walking paths, our access to cheap, good fruits and vegetables, organic, and so on. And we'll use the hospital when we need it, but there are very interesting models coming out now, like the NUCA system in Alaska, where basically the community owns the hospital.
Wow.
And they designed it to meet their needs, the needs of the community. What does the community need? And I think those are big questions. And, for example, in San Diego, we have 2 huge heart hospitals. Do we really need 2 huge heart hospitals? Isn't there some way we can pool our resources and share what we have? But we're just not there yet.
Sure. So you mentioned this Alaskan model. What was it called? NUCA?
NUCA, N-U-K-A, yeah. Just
NUCA. So I don't know if you're familiar. How did they develop this community-based system? I'm just trying to think how we could start to implement this in other cities and other areas.
Right. So I think you should interview. There's a wonderful gentleman who runs an institute called Institute for Sustainable Futures named Jamie Harvey, and and I'm happy to connect you with him. And Jamie's very, very well versed in communities saying we need to do something differently, including like the food commons up in Fresno, where the community basically said, we're hungry and we're making all of this food that's being shipped out to the rest of the country. How do we start to grow food and sell it and feed ourselves?
Yeah.
So these are disruptive models where I think we need to go to transform communities.
Yeah, definitely. I mean, big picture wise, if we're going to do anything right, we're going to have to start to create these sustainable models. I don't think anyone's going to be against that. If you look at it from a big picture perspective, for sure. I would definitely love to be in touch with Jamie, as you said. That'd be a great person to get to be in touch with. So, Dr. Guarneri, you have a lot of drive. I can see that in you, definitely. And you have a passion for serving. Who inspired you on this journey? Who inspires you? Or what was a moment that really, brought this all into fruition?
I'm always inspired by the underdog. I'm always inspired by someone who sees something that's not right, and they have the courage to stand up and say, this is not right. I think we can do it differently. And so I'm really most inspired by ordinary people who do extraordinary things. And whether it's the disabled people who are showing up in Congress and being carried off because they're fighting for their health care. Yes, there are beautiful, inspiring people like Martin Luther King, like Gandhi, of course. But today I'm really inspired by the average person who looks around and says, no, this isn't right, have to do it differently. And that's how I felt about healthcare. I just felt like I couldn't practice anymore in a system that did nothing to prevent disease, that gave lip service to health and wellness, and you put a stent in and a patient's getting roast beef and mayo up in the room right afterwards. That there was such a big connect between the science of health and the delivery of true health care. So that's what inspires me is people that see something that's not right and they go and they do something about it. And, I think it was Martin Luther King who said people will forget that you didn't treat them nicely, but they'll never forget when their friends stand by silently. Wow. And that to me is, fighting for what you believe in, and standing up for what you believe in. Those are the things that inspire me, just like your podcast. I mean, you found an area that needed some help. You wanted to bring these kind of conversations to clinicians and to people, and you didn't say, just think about it. You said, okay, I'll start a podcast to make it happen.
Well, thank you. Thank you so much. Wow. And I have to say that anyone listening to this, now is always the time. If you have a chip on your shoulder, if you're upset about something, now is definitely always the time to act and make a change. So I'm excited. I'm glad that you're inspired by all these people taking action and making change. Dr. Guarneri, what do you think it means to be fulfilled?
I think you have to wake up in the morning and you have to feel like you have a purpose in life. What is your purpose in life? What is your plan de vida, right? What gets you going? And if your purpose in life is taking care of your family and your animals and your children, that's a beautiful and a great purpose. If your purpose is to go to work and make a difference, that's your purpose. But I think as human beings, we all need to be loved. We all need to feel connected. We all need to feel like we're part of something. And I think, I'll give you a 2-second short story. I had an elderly patient, 85 years old, who was very depressed, and he was a World War II pilot. And all of a sudden, out of nowhere, the military called him and said, we found this old plane, and nobody knows how to put it back together. So we looked up who were the old pilots on this plane, and your name came up, and you're still alive. Would you be willing to help us? And oh my God, this guy went from being depressed to getting up every morning. His wife said to me, I pack his lunch. He goes, he comes back at 5 o'clock. He's putting this plane together. His life is transformed. Purpose in life, right?
Wow.
Practice gratitude. Do what brings you joy. Don't put off the important things that you could do today. Don't say, I'll do it tomorrow. Be with the people you love. Don't go to bed angry. And practice your forgiveness work. And really remember what is truly important. What is truly important in this life.
Wow. That was amazing. I loved that story. What a great example of how purpose changes someone. That was awesome. So, Dr. Guarneri, I thank you so much for your time today. Before you go, I have a couple of questions. Number one, what is a tip you would like to leave with the listeners today?
Well, I hope if the listeners are young physicians, young interns, residents, medical students, you have your whole life in front of you. Please do not feel like you have to be totally intense and everything has to be perfect. You need to recognize that you're doing the best that you can do, and you need to get out and be in nature and enjoy yourself. You need to laugh. For those that are hurting and struggling, you need to go to your colleagues and find a confidant, talk to someone. Don't be alone. Call your family, speak with your parents, a friend. Don't feel like you have to be alone in this world because we all do love you and we don't want anything to happen to you. So If I look back, I was a very serious medical student, number one or whatever in my class, and I spent all my time studying, and I missed every party, and I missed every wedding. And I look back now and I say, was it really necessary? I could have done just as well, and I could have had some joy. So I hope that we all remember that.
Wow, I love that. Thank you. That was great. And definitely something that there was a part in there that anyone could use. So I appreciate that tip. Before you go, how can listeners reach you, connect with you, and how can they join you on your mission to improve the health of this planet?
Oh, I wish everyone would come and join us at the Academy of Integrative Health and Medicine. Please go to the website. If you need some CME, go on and take a couple of courses. Join us in September at our annual conference, which is September 22nd here in San Diego. Become part of the change. We are the change. We are the vision. And it takes a tribe. It's not about me. It's about us. It's about we. So if any of this resonates with anyone listening, your tribe is out here. It's called the Academy of Integrative Health and Medicine, and we would love to have you join us.
Amazing. Thank you so much. We're definitely going to provide all those links on our show notes, and listeners can check it out on thehappydoc.com. Again, Dr. Mimi Guarneri, thank you so much. This was an amazing conversation. I'm so thankful for your time today. I'm so thankful for your presence and taking the time to answering all my questions.
It's my pleasure. I'm so glad I got a chance to come on. Thank you. Keep up the great work, Taylor. Keep up the great work. This is really important.
Thank you so much, and take care. Thank you so much for listening to the Happy Doc podcast, the voice of fulfilled physicians. If you enjoyed the episode, please drop us a like, comment, and share. Share us through the social media channels we have on Facebook, Twitter, and Instagram. The handle is at Happy Doc Podcast. That's at Happy Doc Podcast. You can find our website at www.thehappydoc.com. Again, thank you so much for listening to the Happy Doc, the voice of fulfilled physicians.